just started broadcasting. We're going to let participants' numbers are still climbing. Apologize for a little bit of a late start. Know that people are jumping on and off of calls, so wanted to, one, make sure we had quorum, and then two, just ensure that we had the committee members and gave the public a chance to gather. So we will get started. It looks like the participant number has stopped jumping up. So it is 2:07. We'll call this meeting of the Health Fund Advisory Committee to order, and we'll begin with approval of, or consideration and hopefully approval of the minutes from the October 6th meeting. Those were distributed to the committee members, so happy to pause for a minute and give everyone a chance to review if you did not have an opportunity prior to right now.
I have one comment and just a question. And one, I guess maybe it's just style. We certainly know that that Tom Brown is always appropriately looking for sufficient funding to do his job. I just sort of stopped for a minute when I said DAG Brown plugged their funding request. I just wonder if there's a more artful way to say that he was hoping. I don't know. It just, the connotation was sort of interesting to me. But and then this is the technical, and I just don't know the answer to this. Talking about vaping and e-cigarettes, sort of under the category of tobacco, is vaping really tobacco use? I mean, I understand.
So I will defer to a medical professional too, and obviously Don's been heavily involved in this. So obviously people can vape other substances. Like we hear a lot about people vaping marijuana products, but I think in the context of this committee, not that we're not concerned about illicit drug use, assuming people don't have a medical marijuana card or the ability to legally use this substance. We have talked about it as part of this group as teenagers using electronic cigarette devices to vape tobacco products, including flavored and unflavored products.
Okay, I mean, I just didn't know. That was, so it's just really a question, just for my
and if other members have something to add to that as well.
Yeah, Paul, I think my point has always been all along that the tobacco companies are promoting these products.
There you go.
And they have nicotine in it. So it seems a direct correlation between let's get these kids addicted to nicotine and then they'll use our product. That's the line that I connect.
Okay, well, I mean, that's fine. It was really, like I said, just a technical question. I just didn't know. Okay.
Where are the words that you're referring to there, so we could see what your real concern is? I hear your concern, but where in the minutes is that?
Oh, on tobacco?
Well, your point about the difference between vaping and smoking tobacco.
No, it's just that it was under the category of tobacco use. And I just had a technical question of whether vaping involved the use of tobacco. I just didn't know. I mean, I guess
in a technical sense, maybe it isn't, but that's sort of the way we've been looking at it here. It's kind of all.
Exactly. And I certainly take Don's point. So I'm fine. It wasn't a question with the minutes. It was just a question just for me, for my information.
Madam Secretary, I move that the minutes be accepted.
I second it.
Second, so first from Dr. Reinhardt, second from Paula Roy. All in favor?
Aye.
Aye.
Any opposed? Great. So the minutes carry. And obviously, Paula, we can, I think what you suggested was not a substantive tweak. We can look at the wording around presented. I think we can appropriately switch plugged with presented without changing the intent of the meeting, of the minutes. Thank you. All right, and so now to the meat of what we're discussing today. And we realize that members of the public were not able to see these scenarios, so they will be broadcast as part of the presentation. And then to remind the members, it is up to you whether you feel like today we have enough information to actually vote and approve a scenario. We do have time held for a third meeting. If again, you do not believe as though the scenarios today adequately reflect the intention of the group, or there's just more information that we need to gather in advance of a vote. So we will move to the next agenda item. So just to remind folks before we move into specific scenarios, in terms of the funding that is available to the committee, so there is a reserve balance of $4.25 million. The projected payment, and I will channel Tom Brown in saying that obviously this is not set in stone. This is what he believes it to be right now, subject to change and ongoing litigation, but $26.5 million. The FY21 interest is $500,000, and so that gives us a total pot of money potentially to allocate to programs of $31,256,900. The initial scenario that we walked through, again, if all of the applications we received for fiscal year 22, when you add up all of those requests, it is $37,273,000, obviously more than. And so we have a delta of $6,016,000 to solve. So I'm going to be flipping between screens, beg your indulgence. I'm going to first show the scenario one, which was all of the programs funded at FY22, and I'll walk back through these, but this is just the overview. Scenario two, I do want to say before I walk through that I know there was a request by the committee to look at either programs that didn't fully submit an application, had gaps, as well as programs that perhaps had leftover funding. Unfortunately, a review of both of those cases found that we did not have applications that fit those parameters. So we did not have applications that were incomplete. And I think, again, that's a credit to the work of the committee to highlight and really emphasize completeness as at least a minimum threshold for consideration. So it's fortunate that people did that. It's unfortunate, I think, for our work that we don't have kind of some easy answers of, okay, well, those are off the table. And then when we looked at programs that had balances, there were a few, but all of those balances are encumbered, and the expectation is that the program, especially at this point in the fiscal year, there's every expectation that by the time we reach the end of FY21 that those funds will be expended. So again, we do not have any programs that were funded in FY21 that have requested funds for FY22 that are going to have balances that would at least cover or reduce what they request for FY22. So with that, I am going to hopefully not mess this up. I'm going to stop the share of my slide deck and move to the actual scenarios. All right, I didn't mess this up. Then hopefully you all are seeing, again, this is the fully funded scenario. So this shows all of the programs, what they requested. You can see a number of, let me scroll up to the top. You can see that a number of programs have requested money above and beyond what they received in FY21. Which is contributing, that combined with the fact that we just have less money available to us this year is really what's creating this delta between the funds we have and what was requested. So again, it's both a requested increase in funds as well as less money being available. And so that is scenario one. Scenario two, for consideration. There we go. At a high level is really, again, as was requested by the committee, is to look at what would happen if we requested to switch fund, or we took the programs that are for DHSS services off of the tobacco funds. So I will say, as a caution, from talking to the DHSS programs, what people are saying is that the DHSS agencies, that there is not funding within their existing budgets to cover these services. So that's point number one, is that we have to realize that for these programs like the Healthy Children, the Division of Aging and Division of Developmental Disability Services, the respite programs, the prescription assistance program for seniors, the Bridge Clinic for Division of Substance Abuse and Mental Health, as well as the other programs like Lyman House, Gadenzia, and the school survey. If we request that we move them over and the General Assembly does not approve, then those become a de facto cut to these programs. And unfortunately, even with switch funding all of those programs over, we still have a delta to solve. We still do not have, we are 1.4 million short. And that also includes, which is something the committee needs to consider, we're 1.4 million short, and that would be if we utilize the entire reserve balance. So we would preserve no reserves. We'd request that programs be switch funded, and we would still have 1.4 million to solve. Are there any questions before I move on to scenario 3?
Molly, I would just ask the question, and again, I could ask once you get done all the presentations, because I'm sure looking at the alternate 6, it does answer my questions. But my only question was, how are you looking behavioral health differently for the switch programs? Because that does add a lot to the package.
Yes, so these were, again, this scenario is the DHSS programs and the programs that DHSS had previously funded, and we have had years where DSAM has been able to pick up and fund the behavioral health programs. So this would be, again, saying that not only the DHSS programs like DPAP that we run, but also ask DHSS to pick up through the budget process funds that are spending and funding for programs that they had previously picked up in the past.
Thank you.
Yep.
So, Madam Secretary, have all departments submitted their budget requests yet?
We have not submitted it yet for DHSS. Part of it is obviously the HVAC considerations. We requested an extension with Office of Management and Budget to submit it at the end of the month. That being said, it's not clear that even if we make this request, that it will be able to be considered. For those that watched DFAC on Monday, the budget picture's a little bit better than June, which is kind of a low bar because it was very bad in June. So there is still an expectation that the state is going to be in a tight budget scenario. So I do think that the committee needs to consider, as Representative Heffernan said at the last meeting, that a request to switch fund is potentially will be viewed as just a cut. That whatever we say we don't want to fund with tobacco, it may not be able to be picked up in the budget, and so it becomes a de facto cut to those services because they're not included anywhere in either HVAC or the budget.
Madam Secretary, I would suggest that we go ahead and move ahead. And the behavioral funds, at the moment, it's a relatively small. Let's see what the rest of the scenarios look like.
Okay, happy to. So now we are on to.
It is 7.2 million.
No, the behavioral funds are only up 400,000.
Yeah, but I think the secretary was speaking about all the switch funded programs.
Oh, okay. Well,
Oh, it does get confusing. Yes, all of the switch-funded programs together, of which the behavioral health funds represent a small portion of the spending. So I think it's, again, it's a both and. The larger switch fund is a large problem to solve. If we were just looking at the behavioral health programs alone, that would, I think, be an easier item to tackle. So for scenario 3, and again, this is something that the committee requested to see, and not making any judgments about any of these programs, but the request was, you know, as the funding available for tobacco funds continues to decrease, do we need to focus much more closely on the intent of the funds for tobacco cessation, tobacco programming, cancer, et cetera, and then look at programs that kind of fall into the and other health spending. So again, I say this with the caveat that this is not to judge these programs or say that anyone was doing anything inappropriate, but when we look at the what is enumerated in the budget, we believe that the programs that are called a stretch, as in they're that last category, are the Delaware Network for Excellence in Autism, the funding that goes to AIDS Delaware, the Ecumenical Society, the Easter Seals Respite Program, and potentially the nursing programs because they address a workforce need. And so, again, unfortunately, not fortunately or unfortunately, as if, you know, if we just did that, then this problem will be solved. Even doing that, even taking into account the entire reserve, we still have a delta of $2.3 million that we have to solve. So that scenario does not get us all the way there either.
Madam Secretary, again, a comment. I was looking here, the workforce development programs in the recommendation for fiscal year 21, we had that 0 and it was replaced, you know, in the budget. It's a little over $3 million. So at that point, it was thought to be pretty important. So it's just a comment.
Yes, absolutely. And I don't think, again, especially for the public members that are attending, I do want to be clear, it's not that these programs are not important. And I think, Dr. Reinhardt, your point is very well taken. I think it's just a question of, and a point of consideration is, where do these programs belong? Do they belong on the tobacco funds? Or is there a request and intent for the state to try to, and it's really difficult in this is a terrible year for us to kind of have this downturn in tobacco funding at the same time, but you know, we're going to continue, unfortunately, to face this scenario of dwindling tobacco funds and incredible programs that absolutely have benefit to the state and have a track record of doing great work. It's really just unfortunately, and not to be dispassionate about it, but it really does become a math problem of there's just not enough funds in tobacco to go around. And this is the last year, if you remember what Tom Brown said, this is the last year for the settlement bump. And so next year we could actually be, especially if we exhaust all the reserve money, we could end up with, you know, $21 million. So another $5 million reduction that we need to be contemplating. So even if these are not the decision for the committee, I do think it's a critical conversation and consideration, not obviously just for this body, but for the legislature and our department and other agencies to be thinking about what happens to these programs if they can't be funded through tobacco.
Okay, I think that's absolutely right. That, you know, these programs are important. The question is, you know, there was a time, I think I made this point at the last meeting, there was a time when we had a lot more money than we do. And there are a lot of things that were added because they were nice to have and they were important. And this committee thought it was important to invest in some of those programs, even though they didn't fall specifically within the guidelines of how the tobacco money is supposed to be. But so I just want to reiterate or just really support what you're saying, Molly, that it has nothing to do with the importance or the value of the programs. It is, what do we have and how do we spend it using the guidelines that the legislature set forth for us?
Absolutely.
Yeah, I just had one other point of interest, and I don't know whether one has anything to do with the other, but Opiate Task Force and Behavioral Health seems to came up with some kind of impact fees on the opiates, and that is growing just like tobacco. I didn't know whether those are the dollars that could be somehow helping the behavioral health, so at least it takes a little bit burden off. Again, it is still in its infancy. It's still growing. Probably the first year will be about $1 million. But as we know, it's going to continuously grow. Again, I know it's a different bucket and different department within the state and all that, but I just wanted to give the food for thought.
I think that's a great point and something that we've been discussing, obviously, with Senator Hansen, as well as the 3 committees that are set to, that are asked to put forward recommendations for the funding. I do think where it gets a little dicey is the legislation specifically says it can't be used to supplant. Like if the state's already spending money on something, the intent of the funding is a little bit like the innovation fund that you all have created and put forward. It's meant to kind of, how do you stimulate new spending? So I think it's a great point. It's absolutely a conversation and something we should keep on our radar and make sure that we're engaging with Senator Hansen and, others in the legislature around to make sure that, they understand kind of where we're coming from and that this really is an all hands on deck effort to figure out how we keep programs that are vital when, again, it becomes unfortunately a math problem of we just don't have the funding over here. But that's a great point.
Thank you.
Okay, so on to scenario 4. So again, this is in line with previous decisions that this body has made around how do you prioritize cancer prevention programs. We did want to, and by we I mean me, wanted to propose that we keep Department of Justice funded at the FY22 request, since if not for the intrepid litigation and attention by Tom and his unit, we wouldn't have any of this funding. But we would keep all other applicants at FY20 levels. So put that on the table. I feel like a broken record. Unfortunately, we use all the reserve. We still have a delta of almost $2.6 million. So that, again, kind of tried to tinker with the numbers a little bit, and it would absolutely, keeping people at FY20 levels would be a cut because people saw a bump up in funds, but we thought maybe that was the least restrictive way to do it, and we wouldn't have to get into a real 10%, like you'll see in these other scenarios. But unfortunately, again, it just really doesn't get us over that threshold that we need for this year. And again, it would take all of the reserve funding. So we would really be putting ourselves in a position where whatever we get from the settlement plus a minimal amount of interest is really what we're living with next year. And so moving on.
So, Madam Secretary, what was there were 2 scenario 4s.
So I apologize. That was a typo. It should say, it should be just scenario 4, not scenario 4A. So I do apologize. That is a typo. There was only one scenario 4.
And that's the one with a delta of 2.6 then.
Yes, let me put that back up.
Oh, okay.
So this is scenario 4. So cancer and prevention programs at the FY21 levels, Department of Justice at FY22, and then all other applications at FY20. And I apologize, I actually did not show what that looks like other than the high level overview. So I do want people to see what that.
So the one that says 4A, we should disregard?
Yes. Because the 4A scenario was had a cut to DPAP. We have talked to Medicaid, and they have said that statutorily we can't use extra funds, and they expect to expend them.
Oh, okay. Okay.
So that was sort of a late breaking. We're like, yes, we did it. We have a scenario that it would chew up the reserve, But if you took DPAP, and then there was another program that requested less for FY 22 than 21, and that would have about $3,000 to spare. Unfortunately, in talking to Medicaid, they said that they do have the expectation that they will expend the funding by the end of FY 21, and there's not really, we would need a legislative support to carry over a balance, even if we had it. So
Okay.
we will keep that in our pocket. Obviously, if any of these scenarios change, and we have the intent of the committee, we can say if DPAP does change, I mean, we can absolutely look at that if something is to change with Medicaid. So right now, scenario 4, the cancer prevention programs at FY 21, DOJ at FY 22, and all other applications at FY 20 is scenario 4.
Okay.
And Madam Secretary, that I'm assuming that includes the switch funded programs.
That does not. That then reverts back to leaving those programs as is, with the exception of, I apologize, the heroin, the Gadenzia program, and the Lyman House. That leaves them switch funded, but the other DHSS programs are back in the mix.
Right. They're back in. Yes.
Correct. So again, for scenario 4, absent the 2 switch funded, I apologize, we should put that up there. We'll add that just for clarification purposes as people look to the minutes to make sure that they understand that that there is a minor switch fund happening.
Yeah.
Do that right now, so don't forget. Okay, thank you for that. I appreciate that. It's like scenario 54 here. So we go. So now we're on to scenario 5, and there is a 5 and a 5A. So that is still the case. So scenario 5 is a 10% across the board cut for all programs based on what I'm gonna actually put that in, based on FY 21. Except there are 2 programs, Delaware Network for Excellence in Autism, that actually was not funded in FY 21 due to carryover funding. We heard at the last meeting that funding is now expended. So if they are not funded this year, they do not have any reserve funds to rely on. So except for DNEA, and then Brandywine Counseling put forward a program that we have under behavioral health. I don't think that's the best categorization. Honestly, we should probably switch that around. It's a smoking cessation program for their clients, so again, things fit squarely in the tobacco. So all other programs, we took what they requested and what they received in FY 21 and did a 10% cut. Department of Justice is kept at FY 22, and then because DNEA and Brandywine Counseling smoking cessation programs were not in FY 21, we did a 10% cut on their FY 22 budget. And I'll go through the detail. That gets us closer. And that leaves us with we would have to use all of the reserve, and then that would leave us with a delta of just over $500,000. So we're getting a little bit closer. And then this is the specific, so people can see, obviously not to say that these are easy cuts for people. It is difficult because it's less funding for some programs. They're going to be a little bit closer to their FY 20 budget levels, but for some programs, they're going to be even below FY 20. So we are taking people back a number of years. And especially programs that had, that had requested a bump up for FY 22. I think for them, it's potentially an even bigger step backward from what they requested versus what the proposal would be to fund. Does anyone have any questions before we?
Just a clarification, that's 10% of the FY '22 request now, is that?
It's the FY '21 request
FY '21 request, yeah, okay.
for 2 programs that were not funded. They had a 0 for FY '21, and so for those 2 programs, let me go up, this autism support, we took it based on what they requested for FY '22, as well as the brandy wine counseling. They had a smoking cessation program that they requested funding at $52,000. 10% cut on that would be $47,200. But everyone else, it was a starting point, what they received in FY '21, and then a 10% cut on that FY '21 amount.
Yeah, thank you.
Thank you. So these are really good questions. It gets very confusing, and I know people didn't have a lot of time to review, so I don't want to rush through this.
And Madam Secretary, I'm assuming the 10% applies to the innovative fund as well?
Yes. Let me scroll down to that. Yes. So it would be 900,000 versus $1 million. Obviously, that's up for debate. In this scenario, that's how we showed it, but obviously all of this is on the table for consideration.
Madam Secretary, I don't know whether it is appropriate, but American Cancer Society and American Lung Associations in Pennsylvania, at least I had a success that they had some kind of a smoking cessation program, and they were handing out about $350,000 or so. But that was in Pennsylvania. I didn't know whether, again, I know on the other end, they are the same agencies that are asking for money, but then to send somebody somewhere else, for example, brandy wine. I just wanted to bring the thought if there was any other opportunities for some of these agencies to ask for funding.
Sorry to put you on the spot. Was there anything in the proposal, or I don't know if anyone from Brandy Wine Counseling is on, that could just to be responsive to that question, if there was any, if they had identified any other funding source or anything else in the application? I'll give you a minute to look, and then if we could just, while Kiki looks for the answer to that, that's a great question. See if there's any other questions while she looks at their application. Are there any other questions for scenario 5? And Kiki, just let us know when you're able to look at that.
Yeah, I'm looking at Brandy Wine Counseling right now. Scrolling. So they do not receive funding for this project from any other source. And for the question of what would happen if your organization was not awarded health funds, Brandy Wine Counseling is not awarded health funds for fiscal year 2022. The organization will continue to seek other avenues of funding support to bring smoking cessation program to their clients.
Thank you, Keith.
So moving on to scenario 5A, this is an attempt to preserve the reserves and make sure that the expenses fit within the money, uses the interest amount as well as the settlement payment, and leaves a difference. It's not, the math's not exactly on, because as we started tinkering, it just started getting into these scenarios of like a 25.1% cut, but to stick with relatively round numbers, if every program takes a 25% cut across the board, again, with the exception of DOJ, based on what they received in FY '21, except for the 2 programs that did not have FY '21 funding, that would leave us with $4.7 million left over. So it would preserve the reserves and actually add a little bit of money to the reserves. So to look at, really what that would look like, again, this does not preserve any of the cancer programs. This is just a straight across the board 25% to FY21. So you start to see it's really in this scenario that we get below FY20 levels for FY20 funding levels for everyone. And I think, again, it's just, I want to point out that the state is likely to be in the same situation as nonprofits in this scenario. There is no guarantee that if programs take this cut from HVAC, that there will be funding available in the budget to make up the difference. So the assumption is that chances are all of these programs, including the state-funded programs, the SSI, the Healthy Communities, Delaware, that we will likely be taking the cut as well. So just from like an equity and parity perspective, it is our expectation that, again, those would be cut.
Just a comment that would help put us in a position to deal with next year when the special lump sum payment of around $4 million will be gone.
Agreed. I do think, and I'm obviously but one vote, but it is scary to think about expending all of the reserves in a single year, because while this is not an easy year, and again, I'm not trying to gloss over the difficulty that any of the entities that are funded will experience with the cut. It is going to be worse next year. This is going to be this challenge is going to get harder and harder every year, and so to take away the reserve limits the ability. That being said, it is also a global pandemic, and we know that fundraising for nonprofits. I mean, this is a tough year for these, and looking ahead to FY22, this is a tough year to be asking anybody to take a cut.
Secretary, also the state of Delaware has the non-for-profit PPP kind of a funding. And I didn't know, I'm sure most of the applicants should know about it and probably pursuing it, and the money is being rolled out. So I just didn't know whether it was a food for thought. There are some other avenues and the fundings available for those who are going through the pains of the COVID, or as all of us are.
So there is actually announced on Tuesday, there's $100 million potentially available, because people have to meet the statutory requirements to request the funding. There is that funding. It does have to, absent action by Congress, people do have to expend those funds by the 30th of December. So there's always the potential, as I'm sure you all are seeing as well, there's lots of discussion on Capitol Hill about a second or third, whatever round we're on, of stimulus, potentially some flexibility around the funding states have already received. But as of right now, based on everything that's in place right now, people would have to show that it's COVID-related spending and would have to apply for and expend funding by the 30th of December. So chances are, especially since these are already, this is already planned and budgeted spending, that's one of the items that can actually take you out of consideration for CARES Act. If you had already planned to spend the money, you can't now supplant it with federal funding. So again, it's a really good question, and we hope that everybody, irrespective of what FY22 looks like, we absolutely want everyone who thinks they could potentially be eligible for funding through the state to take advantage of that, because it's been a very difficult year. But at least as of right now, I don't think we'll be able to, we don't anticipate being able to backfill any of this funding with federal funding.
Sure.
Okay, so that is scenario 5A. And then the final scenario, again, final pre-prepared scenario, obviously happy to look at other ones, is scenario 6, which is If the committee wants to stick to core mission, for lack of a better term, of keeping cancer prevention and tobacco-related programs at their FY21 funding levels, we want to preserve the reserve. That's lovely. Keep our reserve for next year and beyond. It would require a 35% cut to all other programs. Excuse me, and preserve DOJ at their FY22 request. So again, that's why you see at the top the cancer programs, those taking a step backward, those holding the line, and then other programs like Delaware prescription assistance, $2 million to 1.3. Pretty big step backwards. In the FY22 budget, the workforce development programs were over $3 million. They now step back to $2 million. We do not switch. This does not have a scenario where any programs are switch funded. There are any requests for switch funding. Innovation funds, and again, I think that's up for debate. Do our innovation funds, because it's tobacco cancer related, should that be in the category of preservation? And that should be up at $1 million and holding the line with the other direct tobacco and cancer related programs, versus the 35% cuts, which would take it down to $650.
Secretary, would you be okay if we use, on whatever scenario we want to, use that as a working document, and maybe we go through a couple of items in a little bit more detail? So for example, if you want to use the scenario number 6, I'm okay as long as everybody else is okay. So maybe we look at maybe 3 or 4 categories that are sort of could be looked at it a little bit more in detail.
Absolutely. And I will just pause to say, and I know people have been doing this, but for those that do want to make public comments, if you could please just make sure that you're putting your name in the chat box so that Kiki knows to include you when we move to public comment. Okay, so I'm going to do my best to tinker, but we can start with, and we can go back to any of the previous scenarios too, and kind of start tinkering around like we've done in other years with, well, what if we switch fund that? And so happy to start with scenario 6. Either program specifically or start adjusting amounts to see where that gets us.
Madam Secretary?
Sure, go ahead.
This is Don. I personally, I would not want to start with 6. I think a 35% across the board cut, particularly with our cancer related programs that have been taking hits over the last 4 or 5 years, to the point where less than 50% of the funds are now going to cancer programs, I think is not something that I would support. I have a suggestion on a scenario. It may not be that we can work on it today because it requires some mathematical calculations, but I would not support a 35% across the board reduction.
And I apologize. I think this was just to clarify. Scenario 6 is we would hold the line on the cancer and tobacco prevention programs. Those would be funded at FY21, and because that funding is preserved, all of the other programs would have to take a 35% cut. So
okay.
that could still be a bridge too far, but I just want to clarify that we would hold the tobacco and cancer related programs at FY21 funding. Plus
and also DOJ?
Yes, Department of Justice at FY22. So those hold the line on those programs, and because of that, the rest of the programs have to take an even bigger cut, which is about, if we want to preserve the reserve amount it would be, or the majority of the reserve amount, that means all other programs take a 35% cut.
And I'll rephrase my
Like scenario 19
my
is
point. I would absolutely I would absolutely not support a 35% across the board reduction for the cancer program. So if you're preserving them, I'm happy with that. I'm happy with the DOJ. I also, if I can get on my soapbox as I have the last few years, I'd really like to preserve our reserve. For those of the members that have been around a while, you may remember, because of our fiscal responsibility, we built that reserve up to about 75 million.
Right.
About 5 or 6 years ago, and it's eroded down to 4.2. So I definitely don't want to see the reserve reduced any further, particularly in light of what is going to happen next year with the reduction in the overall master settlement agreement payment. So I'm also, I've spoken the last few years about the switch funded programs, and I just have to echo, Madam Secretary, your comments, and I think Paula's as well. These are all amazing programs, and they do.
John.
After Don.
John.
oh no.
And he was on such a roll.
I can still see him.
Ah.
Oh, you're back. Okay, good. We're like, no, you were just
Yes.
about to make an amazing point.
So I like the idea that we're not cutting the cancer programs by 35%, nor the DOJ. I'd like us to consider some adjustments with the switch funded programs. I understand completely budgetary issues. I know the stress and the issues that all the departments in the state, not just in HSS, but all of them, and they're all doing everything possible to cut as much as they can without eliminating programs. But at the same time, I think we should look for other funding sources for the switch funded programs.
I want to jump on that same theme, but I would also like to see the innovation fund preserved. I think some of those stretch programs deserve really revisiting in view of this. I also would not want to spend the reserve, so I'm just making things tougher. But I also, if it's possible, to preserve those things that are truly what we're supposed to be spending the money for, I would like to see if we can come up with a scenario that we don't even spend the interest, that goes into the reserve. So we start building the reserve up again. So I'd like to see DOG held. I'd like to see the innovation fund held, and the programs like the cancer and the tobacco programs as close to holding steady as possible, and then really taking a hard look at some of the other programs that either do cuts or not only switch fund, but also those stretch programs. I think it's time to start.
Could I ask a quick question? It might have already been answered. How were the stretch programs identified? Are they the programs that didn't meet any of the tobacco?
That's right. They're not, if you look at the purposes that were set forth in the Senate bill that created the tobacco fund,
Mm-hmm.
those were clearly not in the priority. Like any other legislation, there's that catch-all phrase of "and other programs,"
Right.
And so
So these are the programs that didn't meet any of those tobacco categories, correct?
Correct.
Okay.
Correct.
Yeah, but I think, Lena, you're raising a good point. It's subjective. It's because they do fall in the bucket of and other health programs. So
Right.
it's not to imply that anyone was doing anything incorrect for them.
Right.
To
No,
fund.
not at all.
And I think subjectively, you could say, well, nursing programs have to do with access, and so, you know,
Well-
I think this is all part of the difficult decision-making process of trying to come up with parameters around, you know, what the scenarios are, but it is absolutely all up for discussion to consider, again, like what is a stretch. I will say one of the other items, and Kiki, please correct me if I'm wrong, I think in the AIDS Delaware application, they did identify it's a small amount of funding. It's $8,000 was their FY21 level. It's $10,000 requested for FY22. They did say that there is other funding available, or there is at least a strong potential of other funding available if they do not get the tobacco funds. Is that correct?
That's correct. They said they would be able to supplement it through other means, and they said that every year. Additionally, they don't really have a very strong link in terms of which category they pick to relate to the health fund. But they did say that if health funds were to disappear, they would be able to find something else.
I have a question. I'm also interested in preserving the reserve and possibly, let's see, Paula wanted to preserve the interest too, but could we look back? Was it number 5 that was also preserving the reserve? Or was it 4A? I'm not sure now.
It's kind of getting confusing. So scenarios 5, 5A, and 6 all keep the reserve. And actually, let me pull back 4A.
Something 5 does.
They're starting to run together for me too, Dr. Reinhardt.
I don't know. It's true.
No, we have 4. I was going to say 4. Even if we use all of the reserve, we still have a $2.6 million gap.
Well, there was another one though that did maintain the.
Well, I thought it was 4.
I think
But
that was 5A.
Yep, 5 and 5A. So 5 is 10%. It does not preserve the tobacco or cancer programs. It's just a 10% cut across.
Okay.
And then, but it does keep the reserve.
Okay, well,
And then,
yeah, I would like to keep those programs, and I would also favor keeping the new fund there. Let's find the right names for them.
The Innovative Fund.
Yeah.
so we're calling this scenario 6A. 6A, part 5B. I apologize for those members of the public. I realize this also gets confusing to try to do on the fly. So we are going to, for this scenario, cancer prevention 21, so move the innovation fund to consideration. So that is $1 million. So then what that does is it changes us. So now the difference is 3.7. I don't want to insinuate where the committee wants to go. I just want to check for the AIDS Delaware. Are you, based on what Paula said, should I crosswalk the stretch programs over to this budget? So take out the AIDS Delaware, the rest of it. Okay. I'm gonna try to do that. Kiki, help me. Tell me what I'm missing if I missed. So hold on, I'm trying to find. Right, so AIDS Delaware, ENEA. The nurse programs were also identified as stretch. And trying to find Easter seals, and Easter seals respite. Scenario 6A. larger cut for other programs. Remove.
Oh, here's 6.
See, so before I do Don's scenario of also looking to switch funds, I'm just going to check where we are. So this is now a scenario where the 6A, where we are under the tobacco master settlement funds available by $1.5 million. So the interest also gets added to the reserve. Okay. All right, so innovation fund, add $1 million, stretch programs, removed, cancer, tobacco prevention, funded at FY21 levels, DOJ at FY22, and interest added to the reserve. So we have not touched switch funded programs yet, and we are now in a position, again, where there is, actually, I'm going to see what this is. So we have 1.4, if we want to preserve the reserve and the interest, there is about 1.4 million that's on the table for spending the settlement versus what we've identified.
I'd like to make a comment on that. I mean, I think because everything is so tight that we ought to make those funds available to someone, because otherwise we're holding more money back this year than we had last year, and this is even a harder year.
Agreed, Doctor.
Secretary, the question that I had was in terms of, so I mean, I agree with everybody. That is why I thought the scenario 6 was closer to where we were. It was a good working document based on my printout and where I looked at it. I think one other area that I believe in terms of the social deterrence, this year we had $1 million and now we cut back that to 650. So we got that to $1 million. I take it correct now?
So social determinants of health is different than the innovation fund.
No, I understood that, but is the social determinants is the one that I think we wanted to see. Is it possible to increase that to $1 million from 650?
He actually just pointed out I neglected, which I appreciate, I neglected one of the stretch programs. I just have to find it. The Ecumenical Council program. Do you remember what category that's under? I feel like I'm looking past it.
I thought it was other, but maybe not.
It's usually another program.
That's what I thought. For some reason, I'm not.
Yeah.
I'm missing.
Yeah, I don't see it.
Oh, here it is. Caregiver program. Good Lord. Sorry, everyone. Too many numbers in front of me. Okay, so now let me, again, so now we basically have 1.5. If we the interest in the reserve, we have 1.495 million.
That could either go to the reserve or spent on programs that you've just cut.
Exactly.
Okay.
So I was thinking about it, the social determinants that we have 650. I would like to recommend that we make that to be $1 million because as we know, that's going to be needed. And secondarily, I have one other point. In terms of the prescriptions for the $2 million, we cut that to $1.3 million because of the 35%. How's the usage and how are the elderly making without those prescriptions?
I actually think that's an area where the work of the committee that had previously taken DPAP, Delaware Prescription Assistance Program out, due to some of the Affordable Care Act changes of shrinking the donut hole, expansion of Medicaid, which helps with dually eligible, so seniors that are low income enough that Medicaid can step in and pay premiums and prescription assistance. We saw that a number of people, when this program went away, were now sort of, I'm trying to pick the right phrase that's appropriate, but they were basically pushed to kind of go back and look at their the prescription, the Part D of Medicare, to say, well, here are my prescriptions, and here are different Part D plans that based on their formulary actually would cover my drugs. And so we saw that the utilization of that program when it was brought back has actually been lower. So I don't want to speak for Steve Groff, but I do think if we're looking at other programs, that one is probably a safer one to cut to than probably some of these smaller nonprofit funds.
No, that's wonderful.
Because there's space, and the donut hole is now completely closed, subject to the Supreme Court and continued litigation of the Affordable Care Act. But I think there's been positive policy changes in that direction in a way that maybe some of these other programs don't have to point to if they have to.
To that point, I wanted to see if I could add something. I believe to have the set aside for the rainy days of $4.2 million and $500,000 for the interest, I'm of the opinion that we are just as worse the situation that we are in today because of COVID and everything else. So I would love to have that 4.2 as a reserve, but I'm not opposed to spending some of those money that is absolutely needed by some of our programs and have the reserve maybe a little bit less than that, because this is as better a time that we're going to get for everybody that is suffering.
Yeah, again, I think that's an excellent point. And there was a clarification in the chat, which I do think is good to emphasize again, that any of the federal funding that's been available to nonprofits is separate and distinct from what they have to do on a regular basis. So any budgeted expenses, any regular revenues or money received from the state, they're not allowed to basically take federal funding and kind of supplant or do that. So what we fund through the tobacco fund are really core services and programs that may become even more important during COVID, but are really don't necessarily have a strong nexus with COVID. So there's not an opportunity as of right now to take federal funding and say, okay, great, we're going to plug this in where maybe the state has given them a cut. So Monica, I'll put that for the panelists. Thank you again.
Secretary, can I just make a clarification on the AIDS Delaware one? I was rereading it, and I feel like I read Brandywine Counseling's response, and I should read theirs as well. It's a little bit less assured this year from previous years that they can easily find this elsewhere. But in terms of, for AIDS Delaware, if your organization was not awarded health funds, they said they would rely more heavily from grant donors and event proceeds. The food pantry is an integral part of AIDS Delaware's services. The target population relies on the service, and we will do all we can to maintain the food pantry. For your consideration.
Thank you.
Potentially still falls in the category of a stretch, but that is, thank you, Kiki. That's an important clarification that they're still saying that they need the funding. So again,
yeah, in previous years it was very much they could cover it through, I think they have a thrift store also in Philadelphia that they felt they could shift funds, but I guess this year, given everything that's going on, they feel less certain that they can do that. So that's a change from previous years.
Could we possibly partially fund the stretch programs, or?
Well, in the latest scenario, preserving the reserve plus the interest, and doing all the other things that we had done. I think there's 1.5.
Yep, 1.95.
Can we splatter that over those programs?
Yeah, that's why I say that. So if we do that scenario, I want to make sure that I'm on the same page here. That it looks like if we do that scenario, we end up with an additional 1.5 million.
Yes.
And I would, just for the sake of argument, you plug it into the reserve, or you say, now by doing this, we now have another $1.5 million that we can put back into programs.
Correct.
Yes,
Right. I
Somehow.
think we should do that.
I think we should do that too, Doctor.
Yeah. I
I'm in
mean,
agreement. On the contrary, I was going to even go one step above that, is that, as I say, this is as bad as it's going to get in my mind, at least for now. And I'm not opposed to looking at some of the reserves. So we have 1.5 surplus and maybe taking a small portion of another $1 million. So what it would do, it would give people a little bit more money instead of 35% cut. It will get them closer to probably 30% cut on some of the programs that are going to get cut.
well, so the question is how you do that 1.5 million. Do you sprinkle it to everybody?
Yes.
I think some of the challenges with sprinkling are just the nursing programs.
I know
are really expensive.
I think
so.
there's,
And I'm not to all of the lovely people at Del Tech and other places. I'm not trying to make light of what's on the table for us to consider, but you could basically backfill with a 35% cut all of the other programs, and maybe that's what we can look at and see what we're left with. Just again as an exercise in looking at the scenarios. Although now I'm gonna have to do math again.
Yeah. I mean, I'll just say, things are bad. Our revenue situation will continue to decline. So that's why I would like to try to preserve as much reserve as we can for future years, because, our public health situation is not good, but our revenue situation is going to be worse going forward.
Yeah, just to add to that, Paula, we already know, based on Tom Brown's report, that it's likely our MSA payment next year is going to be about $4 million less than it was this year. So I want to preserve the reserve for nothing more than making sure that we're not in a tenuous position next year when we sit down and make these discussions.
And I really, if there's a way to do it, I would like to take the interest and put it into the reserves. I mean, I think in the future, we're going to thank ourselves.
I agree.
Great. So to put back, other than the nursing programs, to put back the ones that were zeroed out as quote unquote stretch, we have $1 million to play with. Play makes it's too flippant of a term. We still have $1 million to consider allocating. I apologize. I want to use appropriate language for the gravity of what we're dealing with. So that would would still be a pretty, the Polytech program. It's really the Delaware Tech, the Delaware Technical Community College that's the driver. We could add in, let me just show this without.
Yeah, add everybody but Del Tech.
Yep.
Ooh.
And Secretary, I just want to flag that Representative Heffernan was able to join us, and she's in here now.
Hey, Representative Heffernan.
Hi.
So adding in everybody but Delaware Tech, and if we want to take the $500,000 of interest and move it into the reserve, there's still $814,000 left.
Just from an equity standpoint and just for the sake of argument, do we want to zero out one nursing program and put others back in?
Well, that's what I think that's what I'm trying to figure out. I'm going to ask Dawn to help. I'm trying to do advanced math here, but figure out, I think it's basically to preserve what's left. Oops, that up. also got a decimal point. Nope, I think it's basically, it would be, to make the math work, gosh, we would only be giving Delaware Tech like 25% of what they requested. I mean, a little more.
Madam Secretary, just out of curiosity, did Delaware Tech request to participate in the comment period?
I have not seen them. Kiki, do you? And I think that's, again, we need to, not that everyone wants to, I realize everyone's time is incredibly valuable, but I think that's a consideration of whether people feel comfortable voting on a scenario today, or whether we need to, again, allow public comment before, if we settle on what the committee believes is a close to final scenario, do we want to have public comment before taking the vote, just to understand what the impacts would be?
Yes.
Yes, I think we should.
Definitely,
Yes.
definitely.
I think that's, yep.
And frankly, if we can't come to a final decision today, I know I can't speak for the rest of the committee members, but I certainly would be willing to have another meeting. This is important enough that we should give it our complete attention. So
I agree.
I agree with
I agree too. I got it on my calendar.
you.
So to basically step back into, I keep tinkering, but to step back into the funding, it would essentially mean that it would not be equal. You could do a 35% cut for the paramedic, the polytech, and the Delaware State, but with what's left, it's essentially Delaware Tech getting just under 30% of what they requested. Excuse me, of what they received in FY21. So it's a very substantial cut over what was requested. Now, if we wanted to add the 500,000 back in from the interest, that gives a little bit more money, but is still, it's not going to be equal. Whether it's equitable is obviously debatable as well, but it's not going to be an equal cut for the workforce programs because of the sizable amount that that Delaware Tech receives.
Well, I'm just afraid if we don't preserve revenue, some of these will get zeroed out because there just won't be any money.
can we consider that scenario, and maybe I'm not picking out Del Tech as kind of a example, but maybe we can speak with them and see what I'm trying to remember, and I don't have in front of me their proposal this year, and whether or not there's other potential funding sources other than tuition in that proposal. So maybe we can speak to them and see what their thoughts are in this regard.
And I can read from their application if you'd like.
Yeah.
What would happen if your organization was not awarded health funds? This is for Del Tech. This would result in a substantial decrease in enrollments in the nursing program, which would extend the wait time for students being admitted to the program and reduce the number of graduates.
Right. Which, yeah.
Once again, an amazing program, and the Nordic nursing shortage about 4 or 5 years ago was at a critical level, and only through these programs has that been turned around. But I'm just wondering if this is the appropriate place to fund that.
That's my question.
And I think that was, again, the discussion from a couple years ago, is that given that these were workforce related, again, it was not, any sort of judgment or lack of appropriateness of the consideration of the request, but it was that where does this fit in the budget? I will say, though, that as an entity that employs nurses, we absolutely still do have nursing shortages in the state. So it's that
No question.
that is definitely still exists.
Well, and I think there's also a shortage of primary care physicians.
Yep.
I mean, the whole health professional workforce issue is near and dear to my heart. So as much as it may not sound like it, I'm looking at it in this context. I think it's a huge, huge issue that the state of Delaware needs to take a look at. And I think they've had some discussions in the Healthcare Commission about the importance of workforce development. So it's not that it isn't important or that people aren't paying attention at all.
Yeah. I do want to apologize. I wasn't sure what the consensus was around moving the social determinants of health back up to $1 million. That will decrease. I think the point is well taken that especially in a pandemic where we're seeing infection and mortality rates that are higher in communities of color and communities that are economically disadvantaged, that is where social determinants of health comes in, but I did not want to assume that that's where the committee was. That will take us back to needing to do bigger cuts to the nursing programs or other stretch programs if we take social determinants of health back up to $1 million.
Secretary, based on looking
Take it back to $1 million.
Yeah, our vulnerable
Agreed.
populations are very affected by tobacco. Like the tobacco companies, target our lower income populations.
We should have been doing this for a long time.
Agreed.
That is the truth. All right. So now we're upside down by close to $1 million.
Whoa.
So we're back to, I think, the nursing programs. Or considering other switch funding.
Yeah. You already did the
and
other
I guess another point of clarification, do we consider the smoking cessation program at Brandywine Counseling a behavioral health program, or do we consider that as in line with the other tobacco and cancer programs? I think we as in me have accidentally miscategorized it. I think we took the entity and didn't look at what it was purporting to fund. We know that smoking cessation or smoking rates are higher in individuals either with substance use and or behavioral health conditions.
Madam Secretary, I think you are absolutely right. It does go into the other categories of the cancer.
I agree.
Yeah, so I will change that on here and we will move that. And I apologize for that. I should have caught that before this. As I was looking, I said, wait, why did I do that? Unfortunately, like I said, I looked to the entity and not the intent. So we will make sure
right.
that
Madam Secretary, I think their request or their fiscal 22 was 18.3. And because we switched the category, I'm sure they probably would be up to 18.3 or whatever the ratios that you are using.
Oh yes, so that's the smoking cessation is they requested 52.4, so and that's a new program, so they would be at 52.4. The school survey in University of Delaware is not. Kiki, am I correct? That's not tobacco. That actually is behavioral health. So that's why they're showing as 11.9 versus the 18,000.
Thank you for clarifying.
So at this point, do we want to listen to some public comment and start getting some reaction, or are there some additional adjustments that we want to look at before opening it up to public comment?
Well, I'm ready for public comment. But
Yeah.
Yes.
Yeah, I think we can do that.
I just want to make sure. I think obviously with people just seeing the fact that their program is up for consideration for cut, I want to make sure we have enough time.
Sure. No, I think that's right.
So Kiki, I will turn it over to you.
Sure. That actually works out really well, since the first person who signed up was Rochelle Brittingham, the Center for Drug Health Studies at the University of Delaware. And I think given we should set a time limit for comments, just given that I'm seeing a number of people pop up. Obviously, we can go back to people if they have additional. Since we have about a half hour left, I think we need to limit. Does the committee think 3 minutes is sufficient?
I think that's
That's good.
absolutely.
Rochelle is able to talk and is with us. Rochelle, go ahead.
Thanks, Rochelle.
Hey, good afternoon, everybody. I'm Dr. Rochelle Brittingham, and I'm here on behalf of the Center for Drug and Health Studies at the University of Delaware to ask for continued support on the Delaware Alcohol, Tobacco, and Other Drugs survey. The surveys have been vital in identifying new and emerging trends in tobacco and substance use among Delaware's youth, such as with vaping and e-cigarettes. The data collected by these surveys are used to inform policies, programs, and evaluation indicators for a variety of committees, such as the Tobacco Impact Task Force and the Delaware Youth Drug Prevention Task Force, as well as state agencies like the Division of Substance Abuse and Mental Health and the Division of Public Health. At any time, agencies and stakeholders can reach out to the Center for Drug and Health Studies to access data from these surveys for presentations, outreach, and grant applications. We're always available to support the work going on in the state. But our work, much like yours, is being affected by the pandemic. First, in order to continue to survey Delaware youth with the added objective of investigating how COVID is impacting their behaviors, vital data that is needed by so many groups, we continue to rely on the funding provided by the Health Fund. Second, in recent years, participation from schools has declined. We recognize that this year especially brings with it competing scheduling demands, preferences for different forms of survey administration, and above all, the need to safeguard safety of students and staff. However, we ask that members of the committee and participants reach out to local districts and school officials to voice your support for these survey initiatives on Delaware youth risk behaviors. Thank you very much for all the work that everyone on the committee has been doing, and stay well.
Thanks, Rochelle.
Great. And next up, I have Nicole Pickles from Cancer Support Community Delaware. And Nicole, you should be able to unmute yourself.
Okay, thank you, Kiki. Thank you, everyone. I would like to thank the Health Fund Advisory for supporting and funding CSCDE's important work since 2002. We greatly appreciate your support, and we could not have grown into the organization we are now, serving all 3 counties of Delaware, and been able to sustain ourselves over the years without the help of the Health Fund. Recently, in reviewing the Senate bill for the Delaware Health Fund, we reconfirmed why we have been supported through the years. Cancer Support Community Delaware provides emotional support and mind-body stress reduction with evidence-based programs and provides improved health outcomes for our participants despite their cancer diagnosis. Our programs are facilitated by licensed mental health professionals with advanced knowledge of cancer, as well as other licensed experts in the fields of physical activity and nutrition, and all of our programs are provided at absolutely no cost. CSCDE is the only statewide organization dedicated to helping individuals affected by any type of cancer in their families while providing services in a home-like setting and now on a virtual platform. The week of March 18th, CSCDE quickly pivoted from in-person services to virtual programming due to the pandemic. We built a virtual platform utilizing our knowledge of what was needed in the communities throughout the state to support the increased mental health issues of anxiety and depression due to the many problems that our patients, caregivers, and families faced and continue to face because of the health crisis. We are proud to be able to say that we have continued to provide services to our at-risk cancer community with 0 days of missed programming. In a normal year, we see 1,100 to 1,200 patient caregivers and families. And this is important, everyone. To date, we have seen over 4,700 people statewide participate in our weekly virtual support groups and programs. We have provided to date 15,000 visits to those and are continuing to accept new registrations daily. However, as our number of Delawareans served since the crisis has surged, so is our loss of funding. We continue to apply for grants, fundraise virtually, and eliminate expenses where we can, but as we all know, it is a very tough financial environment. Cancer Support Community thanks you from the bottom of our hearts for your consideration and time, and if we can answer any questions, we're very happy to do so. Thank you very much.
Thank you, Nicole. Up next, we have Francesca Vogel from the Delaware Breast Cancer Coalition. Francesca, you should be able to unmute yourself.
Good afternoon, everyone. The Delaware Breast Cancer Coalition empowers the community by raising breast health awareness through outreach, education, and support services in order to facilitate early detection and treatment of breast cancer. DBCC's vision is to replace fear and doubt with knowledge and hope for every person who's diagnosed. The Delaware Breast Cancer Coalition has provided nearly 30 years of vital screening and supportive breast cancer survivorship services, focusing on health disparities by eliminating language, transportation, financial, insurance, and access to healthcare barriers in vulnerable communities. Services include life-saving screening programs and education, facilitating affordable healthcare and treatment solutions for those in financial need. A host of survivorship support services are offered, such as one-to-one peer mentoring and mental and emotional support systems and resources, which are especially critical in these difficult times, as is evidenced by program participation rates as high as 250% over last year. COVID-19 unduly impacts breast cancer patients and underserved communities. DBCC staff is working remotely at full capacity to meet the needs of those we serve, converting screening and survivorship support programs to safe online platforms, developing new outreach resources, and building operational infrastructure necessary to sustain increased needs. Unfortunately, fear of contracting COVID-19 has also caused a trend in postponed or canceled preventative mammography screening. Even though things look different this year, one thing remains certain: breast cancer has not stopped. Sadly, the pandemic has created a new challenge to our progress with preventative breast cancer screenings in Delaware, a barrier of fear. Individuals who should be screened are reluctant to do so because of the perceived risk of entering public health care screening facilities and infection from the deadly coronavirus. An alarming national study conducted by the American Society of Clinical Oncologists reports that many Americans have postponed or even delayed preventative screenings such as mammography during the pandemic. Among those scheduled tests whose tests were delayed, as many as 66 reported it was their own choice, a trend we're also experiencing in Delaware. As individuals delay and postpone routine screenings, even as imaging centers begin to safely reopen, the potential for undetected breast cancer increases, making the diagnosis far more difficult to treat in later stages, more costly to treat, and causing mortality rates for breast cancer to increase across Delaware. During these uncertain times, getting screened should remain a top priority. DBCC provides support to public health by operating the state contract for women's health screening and navigates patients to overcome income, transportation, language, lack of insurance, and primary care provider barriers, with a focus on reaching ethnic and disparate communities. Through partnerships with hospitals and screening facilities statewide, women's health screening focuses on the most vulnerable breast cancer populations and those at increased risk to schedule life-saving mammography and cervical screenings, and navigates diagnosed women to providers and resources. Women's health screening staff are trained and certified healthcare interpreters to provide accurate medical translation and interpretation services in both Spanish and Haitian Creole. Women's health screening also works with the state's Screening for Life candidates, navigates women to other insurance resources such as Medicare. In addition, transportation services are facilitated, and DBCC staff utilizes our van and lift services to eliminate transportation barriers and ensure preventative screening appointments are kept.
Hi, Francesca, you've hit 3 minutes. If you want to go ahead and wrap up, that's fine.
Just a sentence. Okay. We have made significant strides in our efforts for early detection and treatment of breast cancer through the state's contract. However, we cannot afford to let pandemic fears undermine the progress we have made through Delaware, or worse, take a step backward. As the committee pointed out in the last meeting, recent studies show that breast cancer is still the most diagnosed cancer in Delaware, affecting women at 30%, and the second cause of cancer mortality. Support for women's healthcare screening program operated by the Breast Cancer Coalition must remain a priority. There is a compelling need to re-educate individuals, especially in vulnerable communities whose pandemic fears have caused them to delay or postpone preventative screenings that may indeed save their lives. I would like to thank all of you for your past and continued support through these difficult times. It means so very much to the agency and to preserving the lives of those we serve. Thank you.
Thank you. Next up, we have Janet, I believe it's Texera from Cancer Care Connection. And Janet, you should be able to unmute yourself. Janet, can you hear us?
Kiki, do you want to just read the comment sheet, or I can, since it's asking you to do it, I can just do it. So Janet had put something in the chat, and obviously we can put her back in the queue if she comes back. She just asked the body if they would consider distributing the amount available proportionally across stretch programs, including nursing, which would give them time to prepare for even less funding next year. And obviously, again, happy to add Janet back to the queue if she would like. Janet, if you are still on, feel free to put in the chat box that you would like to make another comment. Oh, here she is. She said, I do want to make a comment.
Oh, let me put her back in. Okay, she's back in. Janet, you can go ahead. You're unmuted.
All right, let's go to the next one. We'll try Janet again. Or Janet, if you would like to type in your comment.
She says she's talking, but we can't hear her.
Yeah, I don't know. I apologize. If you'd like to include your comment in the chat box, or obviously if there's, we're happy to distribute them to the members, as well as post the public comments as part of the record for this meeting.
Okay, next up is Kirsten Olson from Children and Families First. And Kirsten, you can unmute yourself.
Great, can you hear me?
Yes.
Yeah.
Great.
Yes, thank you.
I'm Kirsten Olson. I'm the CEO of Children and Families First, and I want to first thank you all for what is always a thoughtful approach to such a challenging budgetary issue. I know that you all do your best to meet needs equitably and you know, really using your best judgment to make these decisions, and I thank you for that. I wanted to speak on behalf of our program, the Nurse Family Partnership Program, which is an evidence-based program where we use trained nurse home visitors to deliver services to first-time pregnant women. We stick with those moms until their child turns 2. And there is many decades of research that supports the quality of that program and the really tremendous outcomes that we are able to have. I think you all are well aware that Delaware has long faced challenges related to our rates of infant mortality, early delivery, low birth weight babies, often tied to, we've had some conversation today about social determinants of health. And our program is really focused on serving those first-time moms that are at highest risk for those very issues that relate to the social determinants. So I really just wanted to call your attention to the important work that that program is doing to help moms achieve healthy pregnancies, including ceasing smoking and doing all of that education that we know is so critical to delivering healthy birth outcomes. I was really struck by some of the contrast in the conversation today. Yesterday, the Delaware Early Childhood Council, of which I'm a member, unveiled its strategic plan for the next 5 years. And one of the focuses of that strategic plan is around creating a tiered universal home visiting system to make sure that moms and their new babies are set up for success. So reductions of the magnitudes that we're talking about today in terms of funding cuts will really significantly reduce our ability to provide services to some of Delaware's most vulnerable moms and their children. So I just wanted to make that comment to you all today. And again, thank you for your thoughtful approach to the work and for your longtime support of the moms in our Nurse Family Partnership Program.
Thank you. And next up is Verna Hensley from Easter Seals. And Verna, you can unmute yourself.
Okay, can you all hear me now?
Yes.
Awesome, thank you. I'll echo Kirsten's comments and thanking the committee for doing a really tough job. And it's amazing how you can keep track of all these scenarios and the work that you do to make sure your decisions are based on fairness and need. I just wanted to say I would appreciate, of course, any opportunity to have you continue funding for our respite care, the dollars that we get through the tobacco funding. However, I do understand the predicament that you're in. These respite dollars in particular go to a population of adults with physical disabilities who don't often have another opportunity to get respite dollars. And it's administered really through DSAPID, and we provide the care. But having said that, we would be grateful for any amount of dollars that we're able to receive. The other just brief comment that I wanted to make, I'm much more concerned about if I'm understanding it, it looks like you're talking about a 35% cut in attendant care dollars. Is that correct?
Yes, unfortunately.
Yeah, and that really concerns me because that's a program that allows people with disabilities and especially senior citizens to get care in their home from a personal attendance. And I will tell you, especially in these last few months with COVID and even beyond that, that has just been critical to keeping people out of long-term care and out of nursing homes. So if that kind of cut has to be sustained in the through tobacco funding, I really, really would strongly urge that we try to find some other way to have it funded within the department budget, which I believe that comes under DSAPID and DDDS. So that's my comments. And again, thank you all.
Thank you, Verna.
Thanks, Verna. Next up, we have Sarah Mallory from DNEA. Sarah, you should be able to unmute yourself.
Thank you. Thank you so much for having me here. Excuse me. My name is Sarah Mallory, and I'm an assistant professor at the University of Delaware Center for Disability Studies, and I also directed the DNEA. You may recall that I spoke during your last meeting, and I wanted to take a moment to thank you again for considering application, but then also recognize the incredibly difficult decisions that you are all making through these meetings. I wanted to take a moment to really highlight two things. First is the multidisciplinary nature of our work, as well as its importance now during this pandemic more than ever. The DNEA supports families, mental health organizations, first responders, school districts, and really any professional in the state of Delaware across all 3 counties who works directly or indirectly with individuals with autism. Our work with these professionals is more important now than ever, as the pandemic has forced families and individuals with autism of all ages to face really unprecedented new challenges. And professionals across all these fields are really being forced to think and reinvent how they support individuals with autism, as our traditional methods are not necessarily working or we're able to do. And so now more than ever, our state needs professionals who truly understand autism and who can confidently implement the scientifically based interventions in this new virtual environment. And the DNEA is poised to really support professionals in doing this. You may recall in 2018, this group recommended funding at $500,000 for the DNEA for FY20. And although this funding was ultimately not provided by the state, we were able to rely on remaining funds from prior years to conduct trainings through 2020. We are not currently funded, and so we've had to halt activities. And so while we continue to seek funds to support our work, as you all know, the pandemic has made this an incredibly difficult task. And so any health funds that you can provide will provide an integral foundation for our work. And we would kindly request that you consider funding stretch programs such as the DNEA as partially or any capacity that you're able for FY22 as we continue to work through the pandemic and this transition. Thank you very much again for allowing me to speak, and again, for the incredibly difficult decisions that you're making here today.
Thank you.
Sarah.
Thank you, Sarah. Next we have Jeannie Chicoine from the American Cancer Society. And Jeannie, you can unmute yourself.
Thank you, Kiki. I'm Jeannie Chicoine from the American Cancer Society, and I just wanted to speak briefly and say thank you to the Delaware Health Fund and all of your hard work. Over the years, you have really moved the marble. Unfortunately, Delaware is still second in cancer incidence. However, in mortality, we're now at 15. So what we're doing is working, and I can't thank you enough for continuing to fund the Cancer Council programs, as well as the tobacco control programs, and trying to make sure our youth never start using tobacco products, tobacco substitutes, and just getting Delaware to a healthier place. So they are my sincere thanks.
Thanks, Jeannie. Next, we have Alex Casper from the American Lung Association. Alex, you can unmute yourself.
Thank you. Can you hear me?
Yes.
Yeah.
Okay, perfect. Sorry. As Kiki mentioned, my name is Alex Casper, and I'm the Director of Advocacy for the American Lung Association. We just wanted to thank you for your time and commitment in an especially difficult time and making these incredibly difficult decisions that you have before you. We support the committee's continued commitment to preserving critical funding for tobacco prevention work. As you heard last week during the presentation, or a couple weeks ago during the presentation, e-cigarette use is continuing to grow among our youth. We consider these products tobacco products and tobacco substitutes, as we know they are made by and marketed by the tobacco industry with the intent to attract and hook our youth to a lifelong of addiction, especially as they come in flavors that are appealing to our youth. These rates of youth use are steadily increasing, and therefore the prevention work that's being done is even more important now. We know you are faced with incredibly difficult decisions, and we just wanted to thank you.
Thank you.
Thank you, Alex. That's all I have for public comment. I do have two posts in the chat that I'll read. One is from Linda Poples. At DPH, we are concerned about the proposed cuts to the switch-funded programs and the impacts to these services, especially as we consider other cuts to our state budget requests. These programs were previously general funded and were moved to tobacco funds a few years ago. And Janet was able to write her comments, and she is representing the Cancer Care Connection. Thank you for your ongoing support and belief in the value of our work, recognizing that our program is in close alignment to the spirit and intent of the law governing the Health Fund. Since 2000, we have provided psychosocial care to anyone affected by cancer. In other words, the ripple effect of a cancer diagnosis. Our impact is best expressed in the words of one of our clients. Accessing Cancer Care Connection and the coaches, counselors, social workers there has been the single most helpful strategy to work through the numerous ups and downs that having a cancer diagnosis and treatment brings. I have always felt valued and understood in ways that have maximized my ability to cope with a dizzying array of emotions that I had never anticipated. What an incredible resource. Given the technology issue with my audio, I will end this here, thanking you all again for the earnest and intentional work you do. And that's all I have for public comment, Secretary.
Thanks. So obviously we heard a lot of, a lot of feedback that obviously underscores the difficulty of the decisions. I want to walk through again everything I believe I heard from the committee in terms of an additional scenario that we are considering, and then want to pivot to kind of what we believe our path forward is. So this scenario 6A that we discussed, it keeps the cancer and prevention programs at the FY21 levels. It is a larger cut for the other programs that do not, and Department of Justice we're considering as part of the tobacco, given the importance to the settlement. A larger cut for the other programs of at least 35%, keeps the social determinants of health at 1 million. The nursing programs are seeking a cut, are now left with a cut of anywhere from 35 to 75% in the case of Delaware Tech. The $500,000 of interest is added to the reserve, and we are keeping the reserve. And then to achieve that last point, we need to consider at minimum the switch funding of the behavioral health programs over to DSAM, and doing that essentially keeps, we would need to take about $2,000, so $498,000 of the interest would go over to the reserve, and so that is scenario 6A. What we can do.
I'm sorry, can I just clarify? And we were going to keep the innovation fund.
And the innovation fund is considered part of the innovation fund. The Brandywine Wine Counseling Smoking Cessation Fund are considered part of that tobacco cancer core mission of the tobacco funds, and so they are preserved at their FY21 levels.
Thank you. Okay, just want to make sure.
That's a great. Again, questions are great. We want to make sure we're all on the same page with what we're talking about. What we can do is in advance of, it sounds like I want to be clear and make sure I'm not speaking or misreading the intent. Clearly, we need another meeting. Is that correct? We are not ready to proceed with a vote today?
That is correct.
I agree.
That's correct.
Yep.
So what we can do is we can try to crosswalk with this request, with all of the outstanding requests, some of the healthcare items that we had talked about and had kind of brought up previously. I know we heard that from some of the people making comments, like infant mortality has been a real challenge, and we saw some news journal articles appropriately underlying the continued impact to women of color as they seek medical care. So we can take that type of data. Kirsten also outlined there was a strategic plan released yesterday that really highlighted the importance of home visiting. So what we can do is kind of take some of those continued urgent healthcare needs and try to filter that through the lens of what's still outstanding as another way to provide some additional decision points. Is there anything else that you all would like us to put on the table or provide in the way of additional data or consideration?
Madam Secretary, this was a really, I guess it's somewhat germane to what we're talking about, but I think it's important to recognize that DFACT and their reports change from time to time, but they did find, and I think I couldn't find in my notes the report, but I think it's somewhere in the neighborhood of 270 million of additional revenue, 130 or some directly to FY22. So there is some additional potential funding for some of these programs that may not be able to be funded through HVAC. So I just wanted to give that as some context in our discussion.
Sure. I think, and Emily, I think from OMB is on the line. I think the challenge is the door openers, which are we want to if we want to preserve the programs as is, I think those door openers alone are 200 million. So I think we really, unfortunately, continue to be in a position where the state to basically hold the line with programs is already at least a little bit of a deficit, even with some of the money that DFAC was able to find on Monday. So it is still, as you said, it continues to evolve. We don't know what the pandemic continues to look like for the country and the state. So there's always the chance that there could be more money on the table, whether the legislature sees fit to backfill some of these programs, I think is an open question. Obviously, what you all put forward is advisory, and they have the ability to make some different decisions and determinations. Is there anything else that would be helpful as we look to reconvene and just bring additional either data points or I think, Don, you had a great point. We need to make sure that the scenarios are posted and people understand what's on the table for consideration so that they know how their program could potentially be impacted, so we can absolutely work quickly to get minutes and scenarios online. Is there anything else that you all would like to have us prepare when we reconvene?
Madam Secretary, will we be asking for public comment to review, or are people going to be able to look at the post and then comment on that and send that into us, or how does that work?
Sure. So Kiki, I think you do get emails and other things from people that they can bring in, but we will absolutely have public comment at the next meeting. And if we get any submissions in between now and the meeting, we can absolutely bring that forward and make sure that it's displayed and read at the meeting, and then it becomes part of the official record.
Thank you.
Yeah, in fact, I think didn't Kiki send a letter that she had received with the meeting materials today, as a matter of fact.
Yep.
I'm sure that's going to continue.
You've done a great job, all of you. Thank you.
The true leadership comes into the challenging time like this.
All right. Well, we will again get those posted, bring back, reconvene with the scenarios, including this 6A, and obviously again have the opportunity for public comment and further discussion amongst the committee. Is there anything else that you all would like to raise before we adjourn?
Yeah, Secretary, just for everyone in the public, we do have a Health Fund Advisory Committee website as part of DHSS, and I'm anticipating that's where these scenarios will be posted if they would like to review them. And it's also where previous reports and the last presentation is also located.
Thank you.
Is it appropriate to make a motion to adjourn?
It is.
I second that.
Okay, we have a first and a second. Any discussion?
No.
Everyone's like, get me out of here. All in favor?
Thanks, everyone.
Hi.
Thank you.
Guys, bye-bye.
Bye.
Thank you, everyone.
Thank you.